Good day, everyone. I'm Alan Marco J. Madora, and I'm your student nurse for today. Now, let's do the donning of sterile gown and close gloving.
Assemble the equipment: surgical scrub uniform, cap and mask, sterile gloves of appropriate size, sterile gown, clean flat dry surface for opening gown and gloves. For the preparation, don surgical attire, perform surgical hand hygiene, ensure the sterility of the packages of gloves and gowns. This promotes sterility and reduces transmission of microorganisms. Open the sterile gloves. Remove the outer wrap from the sterile gloves and leave the gloves in the inner sterile wrap on the sterile film. Perform scrubbing of hands and arms. This first preparation is for gowning and close gloving to prevent contamination. Put on the sterile gown. Pick up and unfold the gown. Identify the inner surface of the gown and pick up the gown beneath the neckband. Avoid touching the sterile field or the outer surface of the gown. Move away from the table, holding the gown away from the body at arm's length. Clean hands can touch inside of the gown without contaminating outer surface. Outside of the gown is sterile surface. Allow the gown to unfold from the top down. Do not let the gown touch the floor and avoid dangling the gown against unsterile surfaces. Floor is unsterile, do not let the gown touch it. Completing the sterile gowning procedure. Hold the gown just below the neckband, near the shoulder. Slide both hands and work the arms part ways into the sleeves until the fingers are at the end of the cuffs, but not through the cuffs. Have a co-worker grasp the neckties without touching the outside of the gown and pull the gown upward to cover the neckline of your uniform in front and back. The person tying the gown should take care to touch only the ties, not the front or side of the gown. Careful application prevents contamination. Gown covers hands to prepare for close gloving. Gown must completely enclose underlying garments. Put on gloves. Open the sterile wrapper containing the sterile gloves. With hands covered by the sterile gown cuffs, open the inner sterile glove package. Doing this would avoid sterile hands from being exposed to contamination. Put the glove on the non-dominant hand. With the dominant hand, pick up the opposite glove with the thumb and the index finger, handling it through the sleeve. Lay the glove on the opposite gown cuff, thumb side down, with the glove opening pointed towards the fingers. Use the non-dominant hand to grasp the cuff of the glove through the gown cuff and firmly anchor it. With the dominant hand working through its sleeve, grasp the upper side of the glove's cuff and stretch it over the cuff of the gown. Pull the sleeve up to draw the cuff over the wrist as you extend the fingers of the non-dominant hand into the glove's fingers. Hands remain clean. Sterile gown cuff touches sterile glove surface. Minimal exposure would make less contamination. Put the glove on the dominant hand. Place the fingers of the gloved hand under the cuff of the remaining glove. Place the glove over the cuff of the second sleeve. Extend the fingers into the glove as you pull the glove up over the cuff. Adjust gloves for fit and comfort while maintaining sterility. Maintaining sterility. When worn, sterile gown should be considered sterile in front from the waist to the shoulder. The sleeves should be considered sterile from 2 inches above the elbow to the cuff, since the arms of a scrubbed person must move across the sterile field. Only the items on sight and vision are considered sterile, including the gown from waist to shoulder.